Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com and week 37 of your pregnancy. I'm Monica Healy. This week, your baby is about the size of a cabbage. Can you imagine your baby all curled up in about this size? The final countdown is on. Baby has reached full height, somewhere between 19 to 21 inches, 48.3 to 53.3 centimeters. Weight is about 6.5 pounds, 2.9 kilograms, and is still gaining at about a half ounce per day. Although it is unclear what triggers labor, when your body is ready, baby will be too. Baby is certainly big enough at this stage. Baby's little heart is beating at 120 to 160 beats per minute, much faster than yours, and it's ready to supply his body with the blood and oxygen he needs when he reaches the other side. Baby's lungs are prepared for their first breath, and his adrenal glands are ready to produce the cortisol needed to create the surfactant the lungs need to breathe oxygen instead of amniotic fluid. Baby's immune system is revving to go, but keep in mind that breastfeeding can help pump your little one full of those necessary antibodies to fight infection. Whether you choose to breastfeed or not, only time will allow his immune system to fully mature. Nearly all the downy hair or lanugo has disappeared from his skin, but she may well have a big head of hair. Some babies have hair as long as 0.5 to 1.5 inches. The color of your baby's hair may surprise you, but keep in mind if you are blonde or dark-haired, it will likely change over time. Your baby now spends approximately 30% of the time in quiet sleep and 60% of the time in active sleep when eye and body movements occur. Only 10% of the time is spent awake with limbs moving continually. It is an important stitch of time. During awake hours, she is practicing crucial skills for delivery day, such as sucking, swallowing, gripping, and blinking. You may not feel the intense movement that you did previously because space is at a premium, but you should be feeling continued activity every day. Usually it consists of kicking or pushing, but sometimes you may feel the regular twitch of hiccups, which are an involuntary, sudden contraction of the baby's diaphragm. It is unknown why babies get hiccups, but it is known that although the movements are large, there is no sound, as there's no air in the womb. It is a wonderful time to feel baby move within your belly, but if you should feel a sudden decrease in activity, contact your practitioner immediately. If it makes you feel more at ease, count your little one's kicks. Any movement will suffice as a kick, according to your doctor's directions. Some caregivers do not require patients to count baby's kicks. Now let's talk about what is happening with you this week. You made it. Congratulations. You have made it to full term. Don't be so quick to push baby out just yet. In the next 3 weeks, your little cabbage will still be developing important skills to use in the real world, as well as adding some finishing touches. If you're planning a cesarean section, your doctor will probably advise you to wait until at least the 39th week to ensure that your little one has everything he or she needs for life in the world. Symptoms are not letting up yet, but keep in mind the end. You're almost there. The skin on your belly is getting increasingly more taut, possibly leading to stretch marks. If you already have some, you can expect to get a few more before baby arrives. Slight spotting is a normal occurrence as well, but if you feel that it has become heavier or if you feel uncomfortable with it in any way, do not hesitate to call your doctor. Your caregiver is there to help you. The usual abdominal pressure remains during this time. Has your baby dropped yet? If so, expect some aches and pains from the lower pelvic area. As your womb reaches its highest point, your breasts are probably becoming even larger. Perhaps you did not think this was even possible. They are producing colostrum, a substance rich in nutrients and antibodies. The breast milk that follows is nutritionally balanced and will help protect your baby against infection, as well as build up his or her immune system, nature's perfect food for baby. It is perfectly natural to feel a bit anxious with all of these bodily changes and the upcoming labor. Many women struggle with feelings of anxiety, physical exhaustion, and a general sense of feeling down in the last weeks of pregnancy. Get plenty of sleep, since exhaustion can lead to emotional ups and downs. Remain open with your feelings and express your concerns to your partner, friends, and practitioner. The growing anxiety can also lead to intense and bizarre dreams. This is common as well. At your upcoming weekly checkup, your practitioner will observe your progress by taking into account engagement, the location of the baby in the pelvis, effacement, which is the thinning of the cervix, and dilation. Since you're visiting the doctor, find out what the final results were from your Group B strep test. It is important to know whether or not you tested positive, because mistakes do occur from time to time, and if the information is not found in your chart, you will not receive the proper antibiotics that are needed to reduce baby's risk of infection. So here are some of my tips for week 37. Hospital bag or bags should be packed by now. Don't forget a pillow or even a birthing ball. If you're planning an alternative birthing method, contact your caregiver and hospital to ensure that they can facilitate your needs. Figure out how you're going to get to the hospital, map a route, and take a trial run. Keep in mind traffic patterns during different times of the day. If you're using a taxi, be sure they are reliable and be sure to have the number on hand. Install baby's car seat if you have not done so already. Most hospitals will not allow you to leave until they see the car seat properly installed in the car. If you're up to it, you may want to try perineal massage. The perineum is the area of skin stretching between the vagina and the rectum. This can reduce the amount of tearing as well as the chance of an episiotomy at the time of birth. It may be a good time to have sex with your partner, as long as your doctor has not directed you otherwise. It can stimulate labor. After baby is born, you will need to wait approximately 6 weeks until you receive the go-ahead to have intercourse. So that's it for week 27. If you have any questions or comments, please join in the conversations in the forums at pregnancychat.com. I can't wait to tell you what is happening during week 38. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.